All right. Well, if you have pain or numbness in your legs when you're walking or your toes start burning, something serious may be at play. Dr. Jan Skowronski, said that right?
Perfect, better than I would.
Thanks so much. He joins us now from Brookwood Baptist Medical Center to talk about peripheral arterial disease, commonly known as PAD. So first of all, explain what exactly that is to people.
Kelsey, so good to be here. So first of all, it's amazing how many abbreviations we have in medicine.
Right.
You just call the disease PAD, and there is CHF and AFib, and even if I look behind you, your station is called WBRC.
Yes, exactly.
So we use those abbreviations sometimes with really fully grasping what they mean. So PAD is peripheral arterial disease. It's a disease that your arteries, usually in the legs, but can be in any part of your body, get actually blocked because of cholesterol deposits and due to other risk factors. And because of the blockages, and sometimes we say that the junky stuff gets into the arteries, the circulation gets compromised, causing all kinds of possible problems.
So we're talking about numbness, that tingling sensation. Those are all kind of some of the things that you'd be feeling if you are suffering from this, correct?
So a typical patient, however, there is really no typical patient in medicine with significant peripheral arterial disease and blocked arteries in the legs would simply have trouble walking.
Okay.
And he or she would have difficulty walking more than 50 feet or 100 feet or a block. So very often people just think, oh, I'm getting old and my legs get tired and I just can't do the same stuff as I did 5 years ago, when in fact their circulation is compromised because of blocked arteries.
So once you are diagnosed with this, what's the best treatment method?
So there are two issues here. Number one is this treatment of the problem. Number two is what the problem is associated with. So very often when we diagnose a patient with peripheral arterial disease, we discover a whole bag of other problems like heart disease, risk of strokes, diabetes, high cholesterol, and so on. Regarding the treatment of peripheral arterial disease, it depends on symptoms. Okay. If they are not significant, then we usually treat the patients with medications. If they are significant and they have an impact on quality of life, we have minimally invasive procedures to reopen arteries that don't get good circulation and make the patient walk again.
Okay, well, thank you so much. We appreciate you coming in and joining us and explaining. I know it's a lot, and it's probably you need to go into your doctor and get all of this really explained to you, but thank you for kind of giving us the baseline of what this is. If people do have more questions about this disease, can they contact your office with those questions?
By all means.
And what number could they call?
Okay, well, I'm with Cardiovascular Associates of the Southeast, and I'm just getting used to my new 205 area code.
Okay, so just contact the office.
Just Google us online, Cardiovascular Associates of the Southeast.
Okay, thank you so much. We appreciate you joining us.
Thank you so much. Pleasure to be here, Cal.